Hello and welcome to the Situation Report for Thunder Bay Regional Health Sciences Center's COVID-19 response. My name is Tracie Smith and I'm here today with John Ross. And John, you are a member of the Incident Management Team. Your role specifically is the Planning Section Head. Can you tell us a little bit about what the scope of your responsibilities are in that role?
So basically the planning department looks at determining the short-term objectives for the next 24 to 48 hours. In most IMS structures, this building's Thunder Bay Regional, we tend to look at our planning objectives a little more long-term, but the planning section brings together the ideas, formulates how they're going to work, and then hands them off to be implemented by the operations team. So yeah, just short-term objectives, what we're going to do tomorrow, how are we going to deal with our issues today going forward.
What are some examples of the projects that you've planned and then handed off to operations?
So there's been about 350 of them.
Oh, well then you should have lots of examples.
Yeah, so 350. So we'll start with the first day. Some of the first things that we did here in the building. We started with the assessment center was one of the objectives. You know, the screening at the front door, which is everybody's nightmare, was another one. We look at PPE, we look at infection control, policies, medical directives, lots of things like that, just nonstop.
Really any initiative that's been implemented started with planning?
Most of them, yeah.
Wow, and there's really been over 300?
Yeah, the smart sheet's at line 350 right now.
And that's in the course of the last 11 weeks,
yeah.
Right? Wow, that's a whole lot of work. So what does your typical day look like? So
typically I have great support. You know, we start off with our 8 o'clock in the morning meeting to review what happened the day before, what's going to happen over the next 12 hours, 24 hours. Usually we have about 10 or 12 meetings a day. So then I'll meet with my the rest of my team, which are very good, and we'll look at what each department's kind of doing, what we're working on for the next day, so that we can bring things up at the 4 o'clock meeting to hand over for the next day. It's busy.
What are some of the biggest changes you've seen in your role over the course of all of those weeks? So I'm sure that, you know, since the pandemic began, you've learned a lot. We have grown a lot in terms of the incident management team and all of its branches. What would you say are some of the biggest changes?
So some of the biggest changes, you know, the change process typically is like a 3 to 6 month kind of I don't want to say ordeal, but yeah, ordeal. You know, we've implemented, like I said, 350 changes, and we've done it in a really short period. So the buy-in from our own facility employees has been over the top. Everyone's kind of stepped up to the plate as far as dealing with this pandemic, and things change from day to day. We've had to write the infection control policies for the medical directive 9 times because the symptoms keep changing. As they learn more about COVID-19, we're having to change to keep up with that, and just the flexibility of our staff and support from everybody, just buying into what the goals and what we need to do to get things done effectively has been over the top. Like, I'll talk about hand washing. Remember when we used to do hand washing audits, and our rates were like really low at 60%, I think the number was. We have not had to this point a single staff transmission of COVID-19.
Right.
So something's working really well. Whatever we're doing is really well. Staff are stepping up, they're washing their hands, they're wearing their PPE, they're doing what they need to do to get things done safely.
Yeah, what you talk about there with the staff commitment, it's been phenomenal across the board. And I think it's a sign that we're truly all in this together, and it takes a team to realize the success that we have. Absolutely. So outside of your role as planning section head for incident management, you are also the director of medicine, patient flow, and partnerships. So that doesn't stop while we manage this pandemic. So how has your work with the incident management team impacted your home position?
So my support staff is over the top. Infection control is in my portfolio, and admitting patient flow is also my portfolio. They've kind of stepped up. The patient flow coordinators have been taking things on their own. Nancy has been, basically running patient flow with support from Ann Purvis. They've been doing everything without guidance on their own, and it's been really effective. Infection control has been doing really well as well. They've, adapted policies. They've kind of operated outside their comfort zone in many things where they were not risk adverse. Now they're kind of thinking about what's most important. It's been a good couple of weeks, and I'm very impressed with the leadership that I have. You can see the people who step up to the plate. Some of them I wasn't expecting that, but they've been doing really well. When they've set out on their own, they're handled everything so far to date. So things have gone as well as they have because of their efforts.
Well, I'm really happy to hear that, because given the 300 plus projects that you're working on, you can only do so much in a day. So to have that level of support is really nice to hear about. So what would you say you've learned from this experience so far? Your biggest takeaways from the COVID-19 pandemic to date?
So the community support for Thunder Bay Regional, has been fantastic. We've had lots of people volunteering I've had actually people call me up and want to work at the screening door, volunteer at the screening door. How do I do that? People who, have had treatments here in the past and who are actually immunocompromised and stuff like that have been calling and saying, yeah, I need to help you guys. You guys have helped me in the past. Stuff like that has been, makes you feel a little bit here. Our partners, CCAC and the Lynn and St. Joe's, they've all been very helpful with pushing people through to where they go, and just our community support in general. They recognize that this could potentially be a bad thing. They've stayed home. They've not come to the hospital unnecessarily. They've come in line with some of the more uncomfortable points where, visiting, things like that. They've all come in line with that, are agreeable to the tough decisions that we've had to make for the most point. So yeah, just the community overall has been,
It's
not a lot of complaints.
Yeah, it's been a big burden on the community, and certainly they have come through. I agree completely. So in terms of the hospital's response and the way the incident management team and the entire hospital team has responded, what would you say you're most proud of?
Oh, what am I most proud of? I don't know. I am most proud of the fact that the whole building, the whole community has recognized that there's a problem, and everybody at Thunder Bay Regional, from security right up to the physicians, they've all kind of bought into what needs to be done. They've all stepped up and they've done their job, right? They've truly gone beyond what their expectation was. Pulling extra hours where they're needed, adjusting to their usual what they usually do as far as wearing gowns. They're thinking for themselves outside the box. It may be causing a little ruffle about they want to preserve the PPE, and they want what's best for each other. I am terrible at not wearing my mask, and people are stepping up and telling me about it, right? So it's been everybody's engaged, everybody's bought into this, and moving forward, I think it'll be a better thing.
That's great. We're holding each other accountable, which is how we get through this.
Yeah.
Fantastic. Well, it sounds like you feel very proud to be part of this team and, just happy with everybody's response. It's great.
Yeah.
Well, thank you so much for all of the work that you're doing on the incident management team as well as in your home role as much as you can. It's been a wonderful working experience. Thanks, John.
Good. Okay.
We'll see you again soon.
Thank you.